more you listen, the more you'll know. It's Brian Kilmeade.
Today we announce something new, COVID safety requirement for our health workers. The workers we depend on the most and the workers who are the most vulnerable. We need a strong, clear approach that every single one of our workers gets vaccinated or gets tested weekly. This will begin on August 2nd. All of our health and hospitals staff, all of our clinical workers for Department of Health. It's very clear, and the health commissioner will explain the order he is issuing to put this into effect. Every single one of those employees has a choice. Get vaccinated, the better choice, or get tested weekly.
There you go. Are they allowed to do that? Everybody here is dealing with that workplace, whether it's going to be school in the spring, school in the fall, or right now as they try to go back to work in many cases. So let's answer some of those questions. Bryan Rotella is with us, founder and managing partner at Genco Legal. And Brian also has a particular expertise when it comes to healthcare, which has everything to do with this infrastructure plan that's going to be done on simple reconciliation at some point by Democrats. Brian, welcome back.
Hey, Brian. Always great to be on.
So, Brian, people listening right now are wrestling with that very question. Can my boss ask me, am I vaccinated? And if so, and if not, what does that mean for my testing schedule that I have to go through?
So the first question is yes, your boss can do that. People think that that HIPAA applies, but they don't understand HIPAA is something that your doctor can't go share your information. Or those employers who actually run a health insurance program for you, they can't share information, but they can ask you. And as far as the real question that I'm getting literally every day in my practice, yes, employers can mandate vaccines. I in no way recommend doing that. I've talked a little bit about that before because I think it's opening up major liability for employers that don't have immunity. I think the bigger issue that concerns me is what's going on with these kids. And I'm sure you saw that case in Indiana where they tried to fight back and the court said, no, you've got to have a vaccine to come to Indiana University. Brian, the statistics of under 18, I don't know if everyone knows this, but 335 deaths from COVID under 18. That's all we've had so far. Now, those are obviously tragic. I don't want to underplay that. But that's the number. In Minnesota alone, in 2020, 98 kids under 24 died of suicide. Are we going to start mandating Prozac?
Great point. The other thing is, what happened to the 335? Is anyone studying? How much had underlying conditions going in? What were the circumstances to it? That's what we should be using our money on. What about the kids who get the swollen heart? What is that called again? Eric, I know you pronounce it perfect.
It's
myocarditis. A friend of mine just got this.
And I have tangential evidence that I've got cardiology clients, who've told me they've seen that. They're not 100% sure it's connected, but that's an inflamed heart. So you are taking some risk on this. Is still under emergency approval. It's not fully FDA approved. The analogy I've been using is if for kids playing t-ball, would we ask them to wear a football helmet? Maybe the ball doesn't bounce back and hit them in the head, but is that really necessary? Are they going to be very effective doing that? Or are we overkilling this? I think the country's gone nuts personally. And again, I'm not underplaying how serious COVID is, but for the at-risk population, this is the opposite of what we did so effectively with polio. With polio, you had who was impacted mostly? Children, right? To the point of it, in 1952, we had something like 60,000 cases and 3,000 deaths. They started mandating when you went to school or when you're literally as an infant getting immunized. We should be doing what DeSantis, our governor here in Florida, did, which is focusing on the at-risk population around mandated vaccines. That's the senior living communities, Brian. That's where we had that tragedy up in New York with Governor Cuomo. What are we doing with these kids under the age of 24 with the statistics we have? And for the life of me, I hope this makes it to the Supreme Court in their sense. Why the courts are not getting involved and following seem to have gone down the path of this insanity, I'm not sure.
I'm not sure either. Here's Dr. Marty Makary on kids and masks, which I think affects, there's grandparents listening to us right now, parents, and there are kids listening to us right now. And I think people are asking this constantly. You'll do anything to keep your kids safe. But now, a 2-year-old, cut 9.
He should be ashamed of himself, by the way. The NIH last year spent $41 billion on research grants. 0.4% of that went to COVID. If he is so convinced that masks are needed in kids 2.5 years old, why didn't he fund the study? I'd love to see the data. There's no data, and that's because he has not funded that study. So, I mean, that's the irony of it all.
So here's Dr. Rand Paul on this before I have you comment. Cut 8.
There's no science to have kids in masks. No kids should be wearing masks in America at this point. The death rate is less than the seasonal flu for children. We should treat it like the seasonal flu for children, and we should treat it like the serious illness that it is for those who are older, particularly over 65.
So there you go. Number one, why are you not focusing on this and coming up with your own science? And number two, there's no science to tell a 3-year-old to wear a mask in daycare or preschool.
Yeah, Brian, I would direct everybody to the CDC.gov H1N1 flu back in 2009 and what they put out there. I'm reading from it. Information on the effectiveness of face masks and respirators for decreasing the risk of influenza infection in community settings is extremely limited. So it's difficult to assess. They say here in this CDC, I won't read the whole thing, but anyone who wants to go out and see back in 2009, H1N1, they were saying, we don't really know if masks are effective, so they were using an approach, all right, if you're going to be someplace where you think, let's say, like on an airplane or in a doctor's office, that may be a setting, or you're with an at-risk population where you need to wear a mask. Putting them on two-year-olds, I'll go back to my analogy again, it's putting football helmets on kids playing t-ball. All that's going to do is make them, quite frankly, I think we're going to start having mental health issues as far as their social interactions. And again, I'm not a doctor or provider, but the courts have got to intervene here. And my question is, where is the ACLU? And I can answer it. You know what they're worried about, Brian? They're worried about the illegal immigrant population that's coming over and whether they are getting the vaccine. That's where the ACLU is right now, not on our 14th Amendment right for due process and liberty, and whether parents should be having or grandparents should be having to hear that their children need to be wearing masks or get vaccinated for something. I will go back to that number, 335 deaths. Again, tragic deaths. But to your point, how do we even know, and have we studied, was it actually the direct cause of these deaths?
And we just got to wonder, as parents, legally, can they do anything? They see the damage it does to their kids, 4, 5, 6, 7, 8, 9, 10. They don't know what their teacher looks like. They don't know what a smile, laugh, a frown, what nerves, what fear looks like. They don't see it for 8 hours a day now for a complete year. Is there anything legally they can do before I pivot to the infrastructure bill?
Candidly, yeah, they can go to court and try to get an injunction against these schools, but right now they're losing. The country's in a state of hysteria. The country still feels like, I've commented on this before, that it's in March and April of 2020, not that we are where we are right now in July of 2021.
Brian, there's going to be an infrastructure bill at some point, maybe in the next month, maybe the next 2 weeks, that's going to be pure party pass, and it's going to be on reconciliation. One of the things that's going to be in there that's proposed, and 150 Democrats in the House have signed off on it, and that is to lower the age on Medicare, expand it and lower the age to eligibility to 60 years old. What are the challenges with doing that?
It's the ultimate bait and switch. I'll go back to what I talk about all the time. I'm going to talk about Obamacare very briefly. Why? Obamacare, President Biden opened up an entire period, a new period. Remember, we used to just have open enrollment in October. His special period went from February 15th to apparently August 15th, but they're going to extend it. You know how many people signed up for Obamacare? 2 million so far. 1.2 million of those folks have gotten plans with a $10 a month premium. Why, Brian? The American Recovery Act, remember that? Forget about the infrastructure bill. Poured trillions of dollars in subsidies to these insurance companies, big insurance. That lobby won well here, right? And again, I've said before, there's good insurance companies out there, but Obamacare has basically been completely now funded by the U.S. taxpayer, and Obamacare premiums are lower than what somebody in the 60 to 65, and there's a study on this, population, especially the more impoverished or working class, let's say you make $32,000 in Houston, as an example. You would pay for a silver plan on Obamacare $88. If traditional Medicare, and folks who are on Medicare know this in your audience. Most folks don't know this. There's traditional Medicare, and it's got a Part A and a Part B. The A is the hospitalization part. The B is your doctor visits. A vast majority of people buy what's called Medicare Advantage through private insurance companies. That's what starts jacking up the rates. So under my example, it would cost $284 for that same person making $32,000 in the city of Houston to get Medicare under what they're proposing above the age 60 compared to going on the Obamacare exchanges that are now supersized in their subsidies. I see it as a massive bait and switch, and my personal belief is what you're almost looking at, using the analogy of something like the airline industry, this is a very behind-the-curtain overtaking of all of health insurance by taxpayers' dollars being used as compared, going through to the insurance companies, compared to being paid by what? Your employer contributions, people 60 to 65 work, and also personal contributions. So that's why they're proposing this. But truthfully, for the people who I think really might need it, making, let's say, $32,000 in Houston or $18,000 in Los Angeles, they're getting a raw deal. It's like being told, hey, I'm going to bump you off your first-class flight, but you got to stay over the night at the Newark airport, and I'll put you in coach in the last row tomorrow. That's what people aren't being told. This is a political ploy, and it's ultimately to do what they want to do, which is get as much funding by the government. It's close to 100% into insurance companies and out of employer and personal payments for insurance premiums.
Right, and what they're going to do, too, is you're going to have trouble getting doctors. If everyone's going to be going for free health care at 60 years old and up, are we going to be able to treat these, get treatment for these people? And who's going to want to be a doctor when you have this type of payment?
Yeah, well, we're putting fuel on a fire here because 132,000 is what they're arranging as the shortage we're going to have by 2032 in doctors. Now, we're going through COVID, and we had to deal with bringing doctors out of retirement. We had to open up where doctors who are licensed in Florida, let's say, could practice in New York. We were doing some stuff that we have never done. I don't know that that's safe. In fact, I don't think that it probably is safe. And where have we had the massive shortage? What are we really talking about, which people should be caring about? Primary care. I'll say it again, primary care. Do you think people want to go into primary care when they're going to have this huge influx of people coming in? You know where they are? They're in the specialties. They're in cosmetics. They're in doing surgical intervention. There's more money in that. If I were a kid in college and looking at med school, there's no way I would be considering, and it's sad because I have tons of respect for them and represent many of them, primary care medicine. For people out there, they do this. Watch what happens to how slow it takes for you to get an appointment if you're one of these folks that's on Medicare over 65 when they open it up to 60 and to 65.
You're about to find all that out. Bryan Rotella, thanks so much.
Always a pleasure, Brian.